Good evening. My name's Peter Thould, and I'm going to talk you through my experience, my journey, and the impact a new diagnosis of ocular melanoma has had on me. Just a little bit about me. I'm 54. I'm a father of 3 absolutely fantastic children, 11, 10, and 7. And I've got an absolutely fantastic wife who is just ultra supportive. She's brilliant. The other thing about me is I've worked in the NHS in hospitals around London as a radiotherapy radiographer for the last 30 years. And it's been fantastic. I love my job and I absolutely love the patient interaction. It's everything for me. So my journey started, unknown to me, some 7 to 8 years ago. Popped into Specsavers just for a routine eye test, met a young optician who noticed a freckle at the back of my right eye. And he almost got quite excited about it. And he said, look, I'm going to dilate your eyes, have a quick look. He did that. He said, you've got a freckle, it's a nevus. And I said, okay, do I need to worry? No. He said, but what I'm going to do is I'm going to refer you to Moorfields at Bedford. He said they've got a better camera. He said they're going to get some really good images. And I said, great. So pop along to Moorfields, whole series of tests. Everything is fine. My sight's great. And I come out with a fantastic picture of the back of my eye and a slightly cloudy nevus, the freckle. I'm discharged. Do I have anything to worry about? No, you're fine. Off you go. So I'm feeling really, really in control. So, with all my eyes okay, for the next sort of 4 years, every 2 years, I go along for an eye test. I take my picture, I show it to the optician, and I walk out the shop, and I'm always about £400 lighter, because they've always found a slight little change in my glasses, and off I go. So, then for the subsequent 3-4 years after that, I don't go for an eye test, and my vision's not changed. My glasses are still fine and I'm functioning really well. And then all of a sudden, I start getting these flashing lights and it's like a comet gone across my eye. And then I was thinking, okay, that's fine. And then I get some slight visual disturbance. It's almost like someone's put a little bit of cling film just over the corner of my eye. I can still see everything's great, but it's there. And then the other thing I notice is when I'm looking at straight lines, there's a slight curvature at the top. So I do what any man would normally do, and I leave it for a bit until my wife then says to me, look, you get an appointment and you get straight down there. So I did. Again, met a lovely local optician, had a chat, did some tests. I told her all about the curvature, the sort of distortion. So she said, okay. She said, I'm going to take some pictures. So did one of my left eye, fine. She said, right, the right eye. She said, look at the green dot. And I said, well, I can't see a green dot. She said, no, it's there. It's up in the corner. No, couldn't see it. And I got quite embarrassed. And that was sort of a moment where I started to think, hold on a minute, there's something not quite right. This isn't right. And she said, look, I'm going to give you an urgent referral to Moorfields in London. And I only live an hour away. So I said, well, when? And she said, I want you to go and get on the train right now, and I want you straight down there. She wrote me a referral letter, sealed in an envelope, so I got it. I jumped in the car because my wife needed the car, shot home, and I said, look, Caroline, there's something really going on here. And my wife is a radiographer as well, a therapy radiographer as well. And I said, what I'm going to do is I'm going to steam open the envelope and I'm going to have a look at the form. So Caroline grabbed it, got a knife, and it was open in about 2 seconds, and it was the woman suspected retinal detachment, there was fluid, there was a growth of some description. I get down to Moorfields A&E, it's on a Saturday afternoon, and I've got to say they were fantastic. I spent a couple of hours there, and it culminated with me seeing a registrar, and I had an ultrasound of my eye. And I, as I do now, I always drop in that I work for the NHS, I'm a radiographer, I understand. At my level, I understand cancer and all the aspects of it. And she said, well, She said, what do you think? And I said, from what you've said, I suspect I've got a growth, I've got a tumour. And she said, well, yeah, you have. She said, but I can't confirm what it is. So she said, what I need to do is get a second opinion. I said, that's fine. She said, you need an urgent referral. I said, fine. She said, ocular oncologist. I said, brilliant, that's what I want to do. So I found, thinking about it, in the space of 5 hours, my life had just completely changed. 1 minute I was normal, and the next minute I had a complete unconfirmed diagnosis of cancer. And it's like, what the hell is going on? So that weekend we got home and we just talked and talked. Overall, my referral to Moorfields, or for me to get an appointment, took 5 days to actually get the confirmation. And from the Monday, I probably phoned Moorfields every day. The receptionist was actually getting quite fed up with me until I said, well, I need to know. I need to know what is going on. I thought I could go into work. And okay, yeah, it's a cancer environment, but I feel safe in work. And there's a lot of people, there's a lot of doctors that are friends. And what I didn't want to accept in my own mind is that I was in some sort of free-fall state. I was not in control. I'm not a control freak, but I think everyone likes to be in control of their life as such. And the time from when I'd left A&E at Moorfields until I returned from my consultation with the doctor was a 2-week period from having got the referral date. I found that I didn't, or when I thought about it, I'd just come out of A&E, having been given this diagnosis. I was numb. I didn't really understand what was going on, and I didn't actually have anyone to turn to, or I thought I didn't have anyone to turn to, which is why I went into work, and I thought, well, I can chat to a consultant colleague of mine. I told them what had happened, and they said, I'm really sorry, but I don't know anything about ocular oncology. And all the doctors said the same thing. They said it is such a niche market, and you need to see a specialist. So I did the other thing. I jumped on the internet. There is just too much information, and yes, I understand quite a bit, but I suddenly realised how scary it must be for people with no medical background, because there is so much coming in at you. And for you to try and digest it and understand it, it must be really scary. So I was in a real limbo state. I didn't sleep, I didn't eat, and my wife and I just really talked. So those 2 weeks before I got back to Moorfields, I planned my funeral. I checked all my finances, and probably the most difficult thing for me was having a conversation with my father, and it was really difficult because my mum 30 years ago died of ovarian cancer. My sister 20 years ago had died in a car accident, and I just thought, how must he be feeling? The impact on him was immense, but he's just a fantastic guy, and he's got great belief. And he came through and he supported me. My children at home, it was, what do I say to them? And my eldest is very, for a couple of you that have met him, he's quite an astute little kid. He's quiet, but he knew something was up, and he kept coming back to me for reassurance all the time. So the initial impact on my life and that of the people around me was just absolutely horrendous. But I still couldn't tell them actually what was going on, because everything was still unconfirmed. And every day I would be thinking, why me? So what have I done? Who have I really upset? And why my family being put through this? And I cried every day. I'd walk out in the garden, and it was a release. Got rid of a lot of tension. I was just waiting for that Moorfields letter to come through. Yes, I had the date, but I needed the confirmation. And it arrived, and it was a great list of, I was going to have ultrasounds, retinal photography, laser scanning, chest x-rays, consultation with a registrar, consultation with a consultant, and a surgical workup. And it was like, for the first time in those 2 weeks, it was fantastic because I had an answer to what was going on. I had a plan. The plan was in place. And I felt calmer, very much so. I was calm, and so was my wife. And I thought, at last, when I go there, I can actually get an answer. I can get a diagnosis, which is what I want. I understand diagnosis. I see it a lot. So again, turn up at Moorfields, all the tests done. I'm okay with tests. Clinical settings don't bother me. Anything is fine. In fact, I actually find it quite interesting, and I think it annoys some of the people that are doing the tests, because I keep trying to ask them what they're doing, and a lot of the time it's, Mr. Thould, can you just be quiet and can you just be still? So eventually we get called in to see the registrar, and he does a slit eye examination, and he's quite tentative. He starts talking to me. He says, well, you've got 4 out of 5 tumour indicators. And I just thought, oh, for God's sake, will you come on? I said, look, I work for the NHS. I'm used to it. And he just said, you've got choroidal melanoma. I said, that's fine. That's all I wanted to know. And then he said, okay, he said, what I'm going to do is go and present my case to the boss. I thought, okay, that's fine. So he pops away, comes back in, and he said, right, I'm going to take you to the boss. And it was for him, it was a term of reference. So I walk into the office, and I sat with Mandeep Sagoo, who I've sort of got to know quite well. He repeated all the slit eyes. He did the chatted to me, and he reconfirmed the diagnosis. And the words I really remember from him is, doing nothing is not an option. He said, we will do something. So in those 2 weeks when I was waiting to go in, of course, trolled the internet, and I looked at all my treatment options, and I just thought, I just want to get rid of this thing. I just want it out. So I looked at it and I thought, right, enucleation, and hard as it is, I just thought, yeah, let's get rid of it. And I said this to him, and he sort of said, just hold on a minute. He said, hold on a minute. And he said, there are other options, and we had a really long chat about it. And he said, before we start taking things out, he said, let's try something else. We can always take it out, but whatever. He said, your tumour's 5.2 mils thick. He said, let's do a plaque on it. And I said, okay. I said, that's fine. So he said, that's the plan. Got out his diary. I had a date. Fantastic. I was sorted. And it was like, yeah, I'm on my way. I know what I'm doing. So we could actually then get home, and we could talk to people properly. We knew what we were going. We had the direction. And that was really important, to have a chat with the children, my father, and other people in my community, and certainly in the radiotherapy community, people that I knew really well. And I sort of, at that point, felt, well, I'm now back in a partnership of control with Moorfields. I haven't quite got it all, and I'm handing a lot of stuff over, but it made me feel better. And also the day after, I was going on holiday to Cornwall, so for 2 weeks we could just sit on a balcony, watch the sunset, and we consumed an awful lot of Malbec. It was great. So we come back and we get ready for surgery, or we get ready to go into the hospital. And as I say, having worked in the hospital, it doesn't bother me. I'm happy with the environment. I feel safe. And the plaque surgery didn't bother me. It partly didn't bother me because when I actually trained, I sat in on a plaque operation with a chap called Mr. Hungerford, John Hungerford, and that was, say, 30-odd years ago. And I found it really interesting. But for me, in my mind, I could visually see what was going to happen. I knew it just didn't scare me. Surgery done, anaesthetic fantastic. I was really lucky. I got a brand new plaque, so I only had it in for about 4 days. Family came in every day. My wife came in, brought more wine in. She drank it, went home. I just looked and thought, oh, I could do with one, but no, it's okay. 4 days are up, and plaque taken out, and the next day I'm going home. I must say, the room was exceptionally small, and hospital food is just not fantastic. And so when I came in, my bag, although it had some clothes in it, the majority of stuff was food. It was snacks, and I got through quite a bit. The other thing I didn't appreciate was, having been in this very small room, when I came out, I couldn't get used to the amount of space. It was really, really weird. And okay, 4 days in a room, but you think nothing's going to happen. But you get out and your spatial awareness is gone. I returned home. I had so many drops. I wrote my own schedule for the next 6 weeks. And every couple of hours there was a drop going in. Fine, I could cope with that. I was back in control of what was going on. The only thing I didn't quite allow for, and I've seen it in the patients that I treat, is there was a sort of a separation anxiety from the hospital, because the hospital is safe. It's got everything around. Home hasn't. You'd have to call an ambulance. You'd have to be taken somewhere. And as I say, I see it in people that have some of the radiotherapy treatments for 30 fractions. They get quite close to the end. It's, oh my God, I'm suddenly realising I'm going away from you. And I wasn't sure, well, I didn't expect to experience it. So at home, my wife stayed home for a week, great. She went back, I spent a lot of time on my own, so I talked to myself a lot. My dad got worried at one stage, but he read something that was a sign of great intelligence, so he felt a lot better after it. But it was then that I really started talking to my children. So my eldest, Nathaniel, he came in, he wanted to know all about the surgery, so I talked to him, I drew him pictures, and he would do that quite a lot. He still does it, we still talk. My daughter, Morn, who's 10, for the first few months didn't really talk about it, didn't come, just wanted to know I was okay, wanted to know I was there, would pop in, see I was there, and that was fine. And then my 7-year-old, Laurie, he would come into the room, he goes, Dad, and I go, yeah, what's that? He goes, you going to die? And I said, well, not today, and hopefully not for quite a long time. He'd go back to the PlayStation, and he's fine. And we continue to do that. We still do that now. We're brutally honest with the children, but they accept that. It works for us. It might not work for everybody. So I'm going along, a couple of months down the line, and my conjunctiva's just not healing. There's a couple of reasons why. I pop back into Moorfields, and they say, that's okay, we'll get you back in, we'll re-stitch it up, it'll be fine. They did it under local, which the first time was fantastic, because the drugs I had, I was flying. It was great, and I didn't know an awful lot. And I made the mistake when I'd had the second repair done, because the first one didn't take. I was saying that to the anaesthetist. I said, look, that was fantastic. Can I have the same sort of stuff? I didn't. And I felt quite a bit, and I had a good chat with the surgeon whilst he was doing it. Again, Mr. Thould, can you just be still? So 3-4 months down the line, eventually my conjunctiva is fine. I've because of it, and it was a pain, keep going back in and out to Moorfields, I actually got to see Mr. Sagu a lot more. I actually got a lot more tests done than most people would normally do. So I got ultrasounds every time I visited. And out of a bad situation or a bad experience, I saw my tumour regression go from 5.2 down to 1.7. And it was like, wow, this is working, this is fantastic. And it made me feel, yeah, I was great, this is happening. And eventually, it was sort of, I'd say, everything had healed. And my roller coaster journey, and I just don't like roller coaster journeys, had gone through all the convoluted loops, the circles, and I was now just coming down onto a nice flat plane. I was there. One chapter closes, the other chapter opens, the other chapter being surveillance. And I was signed up for surveillance at Bart's. Bart's is really dear to me. It's a place where I trained initially when I first came to London, so no problems going back there at all. I had ultrasound a couple of months, well, the first few months in, and then after that I was signed up for MRI scans for every 6 months. Again, I don't have a problem with MRIs. I know a lot of people do, and the anxiety that really builds up with it. But I can go in, I can chat with my diagnostic colleagues, or as we call them, people on the dark side, and they're really helpful. And I had one last Wednesday, and I just said, look, I'm coming to this conference. I'm going to talk to a lot of people. How can you help people with the scan anxiety? And they said, well, what we will try and do is talk and allow more time to help. And it's, in today's NHS, time is of the essence. Time is what we don't always have a lot of, but it's what we have to make to try and make things easier for people. So the scans I go through are fine, and I expect that for the rest of my life. And whilst this is, in summing up, this is a journey that none of us want to undertake. None of us ideally really want to be here. The initial impact for me of not having anyone to talk to of any sort of discernible ON knowledge was catastrophic. But for me as a medical professional, or within a group of some very expert people, I've learned so much more about myself. I've learned so much more about the patients that I now treat. I thought I was good. I thought my communication with people was good. I thought I really understood their journey. I didn't. I do now, but only because of what I've got. And I feel that out of something that was very negative, I've now in a much stronger position to help, to support, and to keep people moving in a forward direction. It's very easy, and I used to say, I sort of understand what you're going through, but I didn't. I can say that now. And it's hard, but if I can change one thing, if I can make people's journey better, if I can make their quality of life better, that's what I do. So thank you for listening.
Thank you, Peter.